So I think one of the things that's creating the headwinds that a lot of healthcare providers experience is uncertainty with no lack of continued expectations for growth and for patient acquisition and just to get bigger at the end of the day. And so one of the trends that we really see continuing to emerge is not taking your foot off the gas so much as increasing the confidence that boards and management teams have around decision making. And I think that's one of the areas where we see a really common theme within our client base of folks who are using solutions to, at the end of the day, be much more confident, or at least as confident as they can be in a really uncertain world. And given the pressures that exist from a capital perspective and from a supply perspective, it's something that we see being a real differentiating factor with those organizations that are growing faster than some of their peers within the industry.
Yeah, I mean, I'd agree with that. I think it's interesting how much there's still, I would say, quote unquote, an old school approach to how health systems and healthcare companies approach location decisions. These are major investments. It's not just the cost of real estate, whether you are building a building or you're leasing a space. It's also the equipment that you put in there, and then it's the opportunity cost, right? It's your physicians in there, your specialists. That's your inventory on the shelves. Not to be, trite about it, but you need them to be productive. You're spending a lot of money to make them be productive. If they're in a suboptimal location, not only are they not productive and you're not maximizing return on investment for them, they're going to leave. And we know that keeping your physicians is a huge thing because everybody's trying to recruit these people away. So you got to get past my brokers take care of that. And, we've got some things we've always done. We sort of use our gut. We fly by the seat of our pants. Because to your point, there are many businesses out there that are using analytics, that are using really sophisticated decision-making processes to give them competitive advantages. And if you're still, we use broker X, we're good. If that's all you're using, you're probably not making the best decisions, and you're going to get passed by, especially with how the consumer in healthcare is changing so much too, right? It's not like 1997 or even 2007 where you pick these things. The consumer is changing. They have choice. They can go on their phone and they can make all these things. It's not just the referral from the primary care physician anymore. So all these dynamics are changing, and it's unfortunate to see so many people that are still kind of, we've always done it this way.
Yeah. You hit on a really, I think, important trend of the consumerization of healthcare. And it's no secret that some major industry players, the Walmarts of the world, the CVSs of the world, have, to a sense, pulled back on their strategy. But I think a lot of folks mistake the realignment or the reassessment that they're going through with giving up. And I think one thing we're seeing is in no way are they quitting on healthcare. They're just reevaluating their go-to-market model. And so the ability to leverage the analytics and the understanding of the patient, the consumer, the person that you do business with across multiple channels is ever important as organizations are, again, taking a look at what do we think resonates with the market versus how do they respond, and then making those adjustments from there.
Yeah, I mean, it's really interesting too, because you're exactly right. Those businesses that you mentioned are not giving up on healthcare, but the current state of reimbursement and healthcare insurance made some of the ways in which they had chosen to go to market untenable for a private company, or even if they're a public company, they are a for-profit company, right? And that's where, and we talk about it all the time with health system clients, right, is most health systems are nonprofit. They have a mission, right? They have to serve all people. So you can't do what those retailers you just mentioned did, where it's just like, I'm folding up shop. I'm not going to serve that because I can't make money with the way that Medicaid is, the way the government's changed these kind of things or hasn't done these kind of things. They have to still exist in that world. And it is unprofitable. That's why you see Walmart getting out of those kind of things. They want to help. They have a great mission in what they're trying to do in healthcare, but they're not going to just perennially lose money. That's a different topic, right? When you talk about the state of healthcare insurance and that kind of stuff. That being said, what nonprofit health systems have to understand is that those for-profit companies don't have to serve those populations where the reimbursement is poor and all those types of things, or they're uninsured. And so they can pick, what are the profitable pieces? Well, the systems need those profitable pieces to maintain and fulfill the mission, which in many cases is providing care to these other groups that these for-profit companies don't want to serve. So if they're not doing what the for-profit companies are doing for the more commercial payer side, the more profitable pieces of the business, then they're not going to have the profit to fulfill their missions. And that's a real issue. So again, those are sometimes the people that are still more old school in how they look at things. And there are solutions and there is data and there is, paths forward to be like these for-profit companies, but they can't just, that dynamic's not changing. That's like a wall of water coming out. You can put your hands up and try to stop it, but you're not really going to do anything. That's where it's going.
Well, you've said for years, just because you're not for profit doesn't mean you're a for-loss company.
Yeah.
And so being able to appropriately manage those expectations with those obligations is a key thing in terms of being successful in 25 and beyond.
Yeah. And it's also interesting too. I mean, I think, part of the Affordable Care Act that was really interesting, I think there was a lot of good ideas in there, right? Some of the executions on those things may not have been ideal, but the whole idea is, how do we change the paradigm from treating people when they're sick, and that's where we make our money, to getting paid to keep people healthy. And so I think part of the reason that it was difficult to make work like the government wanted it to at the time was because how do you monetize keeping people healthy when they're not coming in, right? Because they're feeling great and they're doing all these things. So that's where I think, and this is going to seem like a left turn, but where I'm going with that is, and you see all the changes, whether you like them or not, it's touching on the third rail of politics, right? But Robert F. Kennedy coming into Health and Human Services to have some of that focus on nutrition and health and trying to keep people healthier, diet, reducing diabetes, reducing obesity, trying to do that. I think that the reason that there was so much momentum for a third-party candidate was because he was hitting on a lot of things that I think people are wanting in their communities, right? Which is to be healthier, to have better options, to focus on nutrition, to focus on exercise, to reduce the amount of healthcare, acute care that we need. And I think there are businesses in healthcare that are taking advantage of that. And you talk about the consumerization of healthcare. That's really where a long way to get there, but that's really where I'm going, is that there are businesses that are starting to monetize keeping you healthy. And that to me is an interesting trend as we look at 2025 and beyond, because we talked about it's, the old school way of doing things is, you go to your primary care provider, they refer you to things based on any needs that you specifically have. But there are businesses that are taking a sort of B2C, a direct to consumer type, beyond just urgent care or dental, but really into, orthopedics and sports medicine and nutrition and dermatology and, you name them, right? To say, hey, I'm going to go directly to the potential consumer of this healthcare service, and I'm going to promote the benefits of what I'm providing that will keep you healthier. And those are revenue opportunities, because a lot of times those are elective, right? Not everybody, unfortunately, can afford those, but I think that will create a lot of innovation, and there's a lot of interesting things to be done there. New businesses will start up, and also existing businesses, including health systems, that can take advantage of that to create revenue streams that I think then again help pay for some of the unprofitable pieces of their businesses to keep the whole community as healthy as possible.
Sure. I mean, it's the emergence of the concept of wellness.
Right.
It's not necessarily healthcare. It's not necessarily fitness. It's that yet to be fully figured out in between, where you see the private sector very much embracing that and taking opportunities to partner with innovative systems and innovative delivery models in ways that they can better embrace that shared consumer so that they see them on a more frequent basis in a lower acuity setting with way less cost implications associated with it, which I think we're finding is yielding significant returns in the long run. Whether you're talking about the risk associated with managing a panel like that, or simply the cost that the patient incurs along the way, if they are doing a better job of managing weight and staying active and doing all of these things that are, at the end of the day, better for them and better for the system as a whole by keeping everybody healthy.
Yeah.
And so it's certainly a trend we're seeing that will only continue to get bigger.
And also, in the real estate outlook for healthcare, which was great, we talk about the trends of the aging population. That's no, aha. I mean, everybody sees that coming with boomers. And what is it? I think in the report by 2030, pretty much everybody who's a boomer will be at retirement age or more, right? And that was a huge generation. And so I think you've got a lot of innovation in senior care as well, because obviously that represents probably the most need for healthcare as you age. That's just mortality, right? And things like that. But how do you, go from focusing on lifespan to health span, and how do you communicate to these seniors in a way that offers not just, hey, you're gonna get sick and you're gonna die because you're getting old, not to be morbid, right? But that's the kind of, so hey, we're here to help you when that happens. It's more, hey, let us engage with you as you start to get to this point in your life where things could start to break down and something will eventually take us all, right? But let's start to work with you on a proactive standpoint. And so you're seeing innovations, obviously, with service, but also potentially even insurance options and things like that. That's a huge opportunity for healthcare businesses.
Absolutely.
Yeah.
I think one thing too, when you talk about an aging population, we all know a subset of that population are the very providers who deliver care to everyone. And so, one of the struggles, one of the headwinds that everyone faces is staffing. And so as you think about not only can I find a great site, but the next challenge is, well, can I staff that great site once I find it? And so being able to have clear line of sight to, well, who else is in the community? Or depending on your growth vehicle, who is a provider in the community today that may be near those retirement years and ready to step back from active patient care. And so being able to have a very clear understanding of, well, how big is that opportunity? Where are those opportunities? And how can we do our best to stay ahead of them? Whether that's our own internal workforce or opportunities to acquire an existing practice in the market once that provider decides to hang it up, are all certainly trends that we see only building steam as time marches on, but also as investment dollars flow into the healthcare space with expectations of growth. And again, we know growth happens either through de novo or affiliation or organic, if we think about it in a third channel. But really being able to accelerate, again, getting back to that confident decision-making process, finding the right sites, but also appropriately evaluating those existing businesses that are potentially up for grabs. I think is a key thing that continues to influence the overall outlook across the healthcare.
Yeah, and just briefly to add to that, I mean, I think we talked about it at the beginning, but what are you doing to make sure that your physicians, your doctors, your specialists stay with your company? Whether you're a system, whether you're private equity backed, you mentioned it's not just finding the locations, it's finding the staffing, right? And so, that becomes super important to make sure that they are happy with you. Well, how are they happy with you? They're happy with you when they're making lots of money, right? They're making strong activity. They've got full offices and full appointments, and they're doing that. They have ownership opportunities within. So, hey, this person's retiring, let's move you into this. So it's thinking of your doctors and saying, how do we make them excited about staying? Because they're going to have so many options. They're getting recruited all the time. They probably get calls from physician recruiters all the time. And sometimes they're going to make a move. Why are they going to make a move? No one makes a move mostly if they're happy and they're satisfied, and if they have investment or ownership opportunities in some of these things. So that's where location becomes really important. It sounds trite, but it's not, because they're not in the right location. They're not being productive. They're not making as much money. And somebody's going to tell them, come over here and we're going to take care of that. So it's not just that particular practice making money at that location. It's the long term of keeping your physicians happy.
I think the location piece is another just interesting theme that we see showing up, in that, for some operators, some health systems in particular, that have a fair number of locations. They've got a lot of addresses with their name on the wall. But one of the consistent themes that we see when we talk to our clients and get survey responses is that uncertainty associated with, well, am I offering the right services at a given location? Is this medical office building appropriately programmed in terms of what we're offering to the community at large, but also, keeping those providers happy?
Right.
And sometimes, as we talk about, yes, growth will carry on in the face of uncertainty. Sometimes that growth can be the realignment or the just some small shifts within the portfolio of a given system's real estate footprint to be able to just optimize a little more around what are we offering and where, so that everybody is better served at the end of the day. The patients, the providers, and the system's ability overall to operate a more efficient business. And so I think that's something that we continue to see as we think about just how are folks thinking about the years to come as it relates to their portfolio.
Right. And that gets into really, understanding the dynamics, the demographics, but beyond demographics, the behaviors of the people, leveraging all that data that's out there to truly understand the populations that you're operating in. And not all of those trade areas, service areas are the same, right? Sure. And so if you are a system that offers multiple services, what are the best services to offer in that facility? Because again, if you're offering the service in a facility that operates in an area where there's not as high a demand for that, what's going to happen to your physicians for that particular service? They're going to leave. It's just true, because they're not. But so it's your responsibility to make sure that those people are in the best positions to succeed, which means putting them in trade areas that have tons of opportunity. But to do that is hard when you're just looking at demographics, basic population, because you can't really tell all those differences. But there is data out there that can help you understand those populations and right size your service line optimization based on those facilities. If you're only offering one service line, if you're a for-profit, orthopedic business backed by private equity, where are the trade areas that have a high concentration of what I need to succeed? And I don't really want my broker taking me someplace else because it's going to get him a great commission. And that sounds mean, and I'm oversimplifying, but that can happen, right? Let data and analytics drive you where the opportunities are, and then use those brokers to get you in the best lease and best building and those kind of things. They provide tremendous value, but I don't know that I would completely say, I'm going to just turn everything over to you guys to help me know where to go, right? That's where you really need to leverage lots of data and modeling and forecasting. And there's so much to take advantage of out there to help you make the best investments.
Yeah, completely agree.